Hey there, I'm Dr. Ball. Thanks for visiting my YouTube channel. I'm here to just speak to you in everyday language about disease processes, 5 or 6 minutes of your time, so that you can be well informed, so that you can be the best patient you can be for you. Are you ready? I'm ready. Let's get after it.
So, I'm back as promised, and I want to talk about how to disarm this silent assassin, this blood pressure problem. And I want to put a disclaimer in right away. This may take more than 5 or 6 minutes. I'd rather spend more time talking about the solution than I did the problem. So 6 things I want to talk about. Number 1, diet modification. Yeah, gonna have to lower our salt intake. Salt retains fluid. Excess fluid increases blood pressure. So if we can just back off of the salt just a little bit, it will go a long ways in having better blood pressure readings. Number 2, weight loss. Yeah, weight loss. Something we all struggle with. We get into our 40s or in 50s like me, it's gonna be something that you're gonna have to contend with. Baby steps though. Just understand that it takes commitment to start and it's going to take consistency to finish. What happens with obesity and when we're overweight? Well, we have visceral fat. We have fat around our organs. When we have fat around our organs, and in this case our kidneys, it compresses the kidneys. And so it impedes the kidneys from maximal function. And when the kidneys cannot totally operate in their full capacity, it will affect our blood pressure. When you lose that weight, or weight starts falling off of you, you'll notice your blood pressure will go down along with the weight. Pick a goal, 5 pounds, 10 pounds, 15, 20, whatever that weight is, pick it and pursue it. Commit to it, then be consistent. And your blood pressure will thank you. Not only that, the adiposity causes inflammatory responses throughout your whole body, which wreaks havoc in its own way. Another subject for another day. Number 3, exercise. Yes, exercise. Preferably aerobic exercise. Getting that heart rate up. Getting that heart rate up, without being overly technical, causes strong laminar blood flow through our vessels. This causes endothelial, or the inside wall of our vessels, endothelial adaptation. And the way the endothelium adapts is it releases a substance called nitric oxide. And that nitric oxide causes vessel dilatation. And when those vessels dilate, it lowers the blood pressure. And if you keep consistency with your exercise regimen, it opens the channels or floodgates, if you will, of cutaneous circulation. Now, cutaneous circulation study I've found does more than just dissipate heat from your body during workout, but all those smaller vessels also dilate, mediated by a process from another substance called acetylcholine. You get that flush look, when you're working out. We think it's, I'm getting that muscle pump. But really, you could be working out your arms and the dilatation will occur in your legs. You could be working out your legs and the dilatation or dilation of the blood vessels could happen in your arms as well as the legs. In other words, it's not just the muscle worked, but working out in general will dilate muscles or dilate vessels everywhere. Not only that, is it plays a role in lowering your cortisol, which is a stress hormone, which increases vascular tension, which can elevate the blood pressure. So it totally mitigates that cortisol response with regular exercise. Number 4, which is just as important, is increasing your water intake. Yeah, water intake. Sounds counterintuitive. This doctor just talked about how sodium retains water. You don't want to do that, and so forth and so on. But listen, when you constantly and chronically drink an inefficient amount of water, your body will take over and say, we need to help him out. So it'll release a substance called vasopressin. Vasopressin, also known as antidiuretic hormone, will prevent your body from voiding as much as it normally does. In other words, it will hold on to the fluid. Not only that, if you continue on with just drinking inadequate amounts of water, another substance comes to play called aldosterone. And what aldosterone will do is cause reabsorption of sodium, salt, knowing that where salt goes, water will follow. So you got two mechanisms working to keep fluid retained, which subsequently elevates the blood pressure. But when you drink adequate amounts of water every day, the vasopressin mechanism and the aldosterone mechanism shuts off. You drink more water, your body takes what it needs, releases what it doesn't need, and you have no fluid retention. Drink water. Next up, yes. Fifthly is prayer and/or meditation. Yeah, prayer. Studies have shown that when you do this, it can decrease your systolic blood pressure by up to 20 points just by prayer and/or meditation. And the mechanism whereby it does that is it decreases the cortisol levels in your body. We live in a stressful society, stress on every hand, stress on our jobs. Some of us have daily stress in the home, stress that isn't going anywhere. So it's how we deal with the stress is where the difference lies. And prayer and/or meditation, just taking that time, step away from it all and pray. And what you'll find out is that as the cortisol levels decrease, it takes the squeeze, the constant tension, the constant increased vascular resistance off of those blood vessels. They open up, they relax. Blood flows more smoothly, blood pressure drops. Imagine back in the old days before we had those spouts on our water hoses and we wanted to increase the pressure to get that dirt off our car. What did we do? We would squeeze the water hose and increase the pressure, right? And when we wanted to decrease that pressure, we just let up off the hose. Well, when we minimize our cortisol level, it's like letting up off the hose. Blood flows more smoothly, pressure is decreased, and subsequently your blood pressure lowers. And then, of course, there's medication. Sometimes there's no way around it. For some of us, due to the chronicity of our illness or the severity of our illness, the medicine could be a life changer. But for the vast majority of us, medication can simply be a temporizing agent to bridge us as we make these lifestyle changes, as we lower our salt, as we lower our weight, as we incorporate exercise, as we drink more water, and as we learn to meditate and pray. And when those things become a part of our everyday living just as much as brushing our teeth, we may just find after a while we won't need the medicine. Preventive medicine is what I'm about, treating these things that are truly preventable. We talked about the silent assassin last time, the heart disease behind it, the kidney disease behind it, the strokes behind it, the eye disease behind it, and it all can be made to go away. Okay, all right. So if you're at this juncture right now, where you're seeing this part of the video, And you watched it long enough to know there's no longer a need to procrastinate. There's no longer a need to hesitate. There's no longer a need to spectate. It's now time to participate. Click subscribe, click like, leave a comment. It may be a disease process that you have questions about. Put it in the comment field. I'll get to you. I can promise you that. I'll see you next week. Click subscribe, click like. I'll see you soon.